Okay, let's get real for a second. Parenting kiddos with ADHD is exhausting. And some days just thinking about talking to a therapist feels impossible. That's why I love TalkSpace. Here's the game changer. You can text or chat with a licensed therapist whenever you need. No waiting rooms, no awkward, hi. No forcing yourself to talk out loud when your nervous system is already shot. Just real support on your time in your space. If you're shy, anxious, overstimulated, or just flat out done speaking, this is life-changing. You type, they respond, and suddenly support is literally in your pocket. And the practical mom part? TalkSpace accepts most insurance. The average copay is around $15, and a lot of insured members pay $0. No insurance? Still covered. You can get $80 off your first month with promo code SPACE80 when you go to TalkSpace.com. So if you've been thinking, I need help, but I can't even, this is your sign. Match with a licensed therapist today at TalkSpace.com and save $80 with code SPACE80. Less guilt, more support. That's the energy we're bringing into 2026. Buckle up, Chaos fam, because today's guest is exactly the kind of clinician you've been asking for. Dr. Mary Lou Hulseman isn't just another MD with a stethoscope and a prescription pad. She's a 35-plus year veteran, family physician, who took everything the medical world threw at her and said, cool, now let's actually help neurodivergent kiddos thrive. She's the founder of All Aboard Integrative Medicine, where she's flipped the script on conventional care for kids with ADHD, autism, and other developmental or behavioral challenges. Instead of throwing meds at symptoms, she digs into what's actually getting in the way of development, like nutrition, environmental stressors, or underlying medical issues. Here's the part that should feel like a warm hug to every single one of us. Dr. Hulseman literally came to this work through her own child's journey. She saw firsthand how integrative, science-informed care changed her daughter's life, and now she's on a mission to bring that same hope and actionable strategy to families who have been left with nothing but a list of diagnoses and zero direction. So get ready. In a world where ADHD parenting advice often feels like bumper stickers and band-aids, Dr. Hulseman is about to bring depth, evidence, grit, and heart. And we're diving deep into what actually works for your kiddo's brain, body, and freaking future. Let's welcome Dr. Hulseman to the mic. Dr. Hulseman, welcome to Chaos and Caffeine.
Thank you. Thank you very much.
I feel like this is divine timing. I know we had tried to meet a couple of times and it didn't work out, but just this very week, we have learned that my kiddo cannot take stimulant meds anymore. So maybe you were sent right to me on time.
I hope so. I hope so.
Yeah. Before I jump into all the questions I am just so desperately wanting to ask, do you mind telling our listeners who you are?
Mm-hmm. Sure. So my name is Mary Lou Hulseman. I'm a family physician by training. I practiced for 34 years. I started out doing traditional family practice, including deliveries, did deliveries for the first 13 years of my practice, traditional family practice for about the first 10 to 15. And then I started to develop some health challenges myself, and our daughter had some significant behavioral problems and was diagnosed with it was called Asperger's at the time, but an autism spectrum disorder. And we were really frustrated because we couldn't help her very well. She was very bright, very talkative, but causing all kinds of chaos and difficulties in the classroom, very poor focus, although she was very smart, is very smart. And we tried medications, which only made her worse. We tried therapy, which should have helped because she was very motivated, but it never helped. She could never follow through. And then I started to realize that, maybe it had something to do with nutritional deficiencies and diet and environmental toxins and difficulties clearing infections. And as we addressed those things, her problems went away. And in fact, her autism diagnosis completely went away by the time she was in high school and was retested. So that kind of led me down realizing, okay, a lot of the kids that we're dealing with don't have a purely genetic problem, that there's some environmental and genetic that's affecting them. And what are all of those different factors? It's typically not one thing, it's typically multiple things. What are those factors in that individual child? And how can we address those factors to get them on track developmentally and doing well? So for the last 10 years now, I've been primarily doing integrative medicine with mostly kids with autism and ADHD and anxiety and OCD, a lot of the behavioral things that either don't respond to medication or don't respond well to medication, and certainly aren't fixed by medication. Really looking at all those different things, what nutritionally might be causing a problem and what does the child need. So I'm always trying to think about what needs to be taken away, what's causing the problem, and what the child needs to help them optimally function and do well. And my goal is optimal health, which also goes along with optimal focus, optimal attention, optimal speech, all those sorts of things. So that's me. I have my own private practice. I was working with a large health system for many years, and in April of last year, opened my own practice in Fishers, Indiana. And it's unfortunately one problem with that is I can no longer take insurance, but I try to keep my prices affordable for us given the service we try to provide. I have a nurse that I work with who's outstanding. So that's me.
Thank you so much for that. I have even more questions just from your introduction than I had originally planned to ask.
Okay. Go for it.
Do you feel the transition to your own practice has kind of taken the reins off to where now you can explore and dive in more creative ways?
Well, more creative therapy options because I'm not under the so I was very fortunate in the 27 years that I worked with Community Health Network in Indianapolis. They were very open-minded about allowing me to basically, as long as there was nothing bad happening, I always got good patient reviews, there were never any lawsuits or anything like that. They didn't interfere with my practice. But in that sort of setting, there are types of therapies that were a little harder to do than others, although Community actually purchased hyperbaric oxygen chambers for me, and I was allowed to provide that therapy to patients for a long time.
Wow.
Now, they very appropriately had me get studies that showed that it was beneficial and also had me do my own little research study to show a benefit, but they didn't hold me back. So the answer is a little bit. I can do a little bit more, but I was actually very blessed to be in a very unusual situation that was super open to not interfering to my practice as long as everything was fine. And when I came to Indianapolis, I joined a small group that then was purchased by this larger system. And that small group was owned by my partner of that time and current very good friend, who was very open to, as long as it was good medicine and I was careful and good documentation and people had good outcomes, then it was all fine. So in my case, contrary to many of my colleagues around the country who get more pushback from conventional medicine, I didn't really get that, fortunately.
Fortunately.
Again, probably it's because I started out doing traditional family practice with a wonderful open-minded partner and then eased into my integrative practice. That's probably why that transition went so well. And basically left because there's lots of stressors on healthcare systems that make it very hard for them to give doctors enough time to take care of patients well. There's a big crisis in so many different aspects of our healthcare system. And to really be able to give the time it takes, it just wasn't affordable for the hospital anymore.
Yeah.
So they didn't kick me out. It was mutual, but it was kind of clear I needed to move along.
Yeah. So I guess I need to start with giving you a full confession. I have been an ADHD parent for 6 years. And until I joined the online communities to basically give me info on how to be a better parent, I was oblivious to the fact that there were major nutritional deficiencies in our lives. I had no clue about pandas. I was unaware of environmental toxins, heavy metals, mold. I was clueless. I had literally no idea. I'm so fortunate now to know so much more than I did, but I think that that's the case with most of us. We really don't even think about that until it's thrown at us.
I would completely agree. I would completely agree. And part of the reason I think that most conventional doctors don't know about this is because they haven't yet been forced into that situation. So the whole my medical school was okay with nutrition, meaning we had about 2 weeks. very little. And very little in discussing, well, how could a nutrient impact biochemistry to then change the underlying what's going on with that individual? There was nothing about that. And nothing about environmental toxins. Maybe a little bit, you should not have lead in the water, but not in the type of detail that we need to be paying attention to it.
Yeah. So I'm sure there are many nutritional deficiencies that you see, that you come across. What are the ones that we need to be aware of?
Well, specifically, you're wondering about ADHD?
Please.
Or about, okay, specifically with ADHD, I actually gave a talk. I don't know if you had an opportunity to listen to this talk or not. I gave a talk sponsored by NeuroNeeds where I went through the different things and so some of that I touched on there. And in general, the nutritional deficiencies for ADHD aren't a lot. Omega-3 fatty acids, phospholipids, zinc, are nutrients that can make it difficult to pay attention to. Medical problems that can make it hard to pay attention are things like hypothyroidism and sleep apnea. It's more what might person be eating that interferes, I think. And the biggest things are dyes in the diet, but also sugar. And we know that breakfast is key for kids to pay attention. And what we do know is that kids who don't have breakfast pay attention the least well. The kids who have a sugary breakfast pay attention very poorly as well. But the kids who have a good breakfast, high in protein, low in sugar, no artificial dyes, are the ones who can pay attention the best. So that's the nutritional piece that I focus on mostly. Does that answer the question you were wondering about?
Yeah. So I guess I'm focused on a lot of things that are not as relevant as I had thought about it. But I guess it kind of goes case by case. It would be child by child, pretty much.
Absolutely. Yeah, absolutely. And many of the things as I'm treating kids with these issues, there's some testing that can be beneficial, but usually it's trials of treatment. Okay, let's go through what your child is eating right now in some detail, what they're eating when, what happens around food and meal times. Do they actually sit still? Is there a family time when we can sit and process things, or are they kind of all over the place? Are they a kid who's so distracted they're watching their iPad, and all that makes it even harder for them to eat nutrition? So those factors all around eating is also important as well. And then trying to figure out then what is the diet actually consist of. And then once we figure that out, say, well, what about removing all artificial dyes? What about making the diet totally organic? I've had kids improve tremendously just doing that. I also usually have people do a trial of being gluten and dairy free. More importantly for kids with significant developmental delays like with autism. But I think even kids with ADHD, it's really on the same spectrum in my view, but it's worth a trial off of those foods and then reintroduce and see if there's a difference. And then if there's a difference over time, we hope that we can get the gut healed so those problems go away. But with some exceptions, like the reaction to artificial dye, that's genetic. Nobody should be eating that crap anyway. So we should keep that out of the diet anyway. But if somebody can, like, temporarily doesn't tolerate dairy but tolerates dairy, I'm totally fine with that, as long as it's healthy, organic, as much as we can get that in our country, which is another big deal. We have so many pesticides and so many things added to our foods. It's a big problem, and it's impossible to tell how much, for example, glyphosate or Roundup that's sprayed on corn and soy and then gets into our milk and our meat, how much that's interfering with it's probably interfering with other health issues, GI health and cancer risk and that kind of thing.
So Dr. Hulseman, let's say, for example, we had a kiddo who only eats French fries and chicken nuggets and needed a device to stay still during eating. Just pure example out of the blue.
Well, first of all,
not that that's what's going on in my home or anything.
I get it. But do they need to stay still to eat? That's one question. Because sometimes I think the kids, this is a little bit of a aside, but I think sometimes the kids are hyper because they're trying to be engaged and have attention, and their energy on a cellular level is actually not very good. So they're hyper to try to stay engaged. So that's one thing. The other piece is that there are lots of problems with the tablet, of course. One thing that really frustrates me now is it's very hard to download things and then watch them. Most things are streamed, and so that means there's lots of EMF energy coming in and out, right? That tablet, right in that child, which can't be good for the cell function, especially in the brain.
Yeah.
So that's a little bit of a separate issue. And the ideal thing is that it's difficult to do if you've been using them, but the ideal thing is we don't have our kids using those devices until they're teenagers, honestly. More and more data is looking that way, that like kids should not have a smartphone until they're late teens. Maybe we should go back to the flip phones for our preteens who need those, but not be letting them do social media and watching YouTube nonstop, because it keeps them from doing other things that promotes their development. A little bit of an aside. In terms of the not eating kinds of things, there's something not right about that kid's gut. And probably they have significant nutritional deficiencies if all they're eating is French fries and chicken nuggets, and they won't even try anything else. And then I need to dive down a little bit more and say, well, is it that they won't try anything else, or that something else literally makes them sick? Like I've had kids where a food goes close to their mouth and they throw up or gag. They have super sensory aversiveness. So that's one kid. Or there's another kid where they're picky, and sometimes the pickiness may be because they're just picky, and that can be a trickier one to work around, honestly, in some ways. But it could be because they're zinc deficient. If your zinc is very low, your sense of taste is poor, and then you can't eat very well. So getting the zinc tested and treated appropriately can help as well. So then the other thing is, well, how those French fries, how healthy are they really? Are they actually, say, McDonald's or Burger King French fries, which may or may not have that much potato in them, actually, and are cooked in really bad oils? Or are they a potato that you can cook in a healthier, say, avocado oil, so it's not quite as bad a quality and has sea salt on it, for example? And are the chicken nuggets organic when grass-fed, free-range chicken nuggets? If you at least do that, you're going to move into the right direction. But a kid like that, I probably would try to make them gluten-free. Sounds like they're pretty close if they're just on chicken nuggets, in case that makes a difference. Sounds like they're dairy-free if that's really all they're eating, right? And then, then I try to see, well, what else do they eat? Do they drink anything else? So for example, drink a fruit juice. So a kid who drinks a fruit juice, you can sometimes get a very high quality multivitamin mixed in the water that can help them. There are more and more healthier vitamins there too. There's a lot of junk as well, but there's some healthier things now that are coming out that I would at minimum have that child on, because they're deficient a bunch of stuff if that's all they're eating, right? And then sometimes feeding therapy can be helpful. Again, it depends on the degree of the problem with the kid. If the kid doesn't have a lot of sensory aversiveness, feeding therapy can be very, very helpful. If they have a lot of sensory aversiveness, there's something really wrong with their GI tract. And then I'm going to be thinking about probiotics, maybe doing some urine or stool testing to see is there an occult infection there that needs to be treated. So it can be pretty detailed, but it's a clue that there's something not right nutritionally and something not right maybe with their GI tract for a kid who won't try any of those other things. Answer the question? Now, I don't know that the tablet is interfering with their willingness to eat other foods. I think it may be more that something that's driving the hyperactivity is the only way it can get them to sit down is the tablet. And usually that's the case. Yeah.
Yeah. That sounds like us, for sure.
Yeah. It's a tricky problem.
Or if his mind is busy, he's there, but as soon as there's nothing there, our hands are free and our mind is free, it's like he's all over the place.
Yeah. His engine's on overdrive.
Yeah. Yeah.
So in a kiddo like that, it may depend on what else also has gone on historically, which we didn't really talk about, because I'm thinking about a kiddo who's like that. What has happened to them in the past in terms of during the pregnancy? Was there a lot of stress? Were there antibiotics used at the time of delivery? Was he having recurrent antibiotics, which to me is more than once, during his first few years of life? That's going to alter that flora and make him more likely to have yeast overgrowth generally, sometimes other bacterial or parasitic overgrowth. Yeast overgrowth is often hyperactivity, but it also can be silly giggling, waking up in the middle of the night, chewing on things, teeth grinding. Those are all signs of yeast overgrowth. Treating that can help with focus and help with that hyperactivity.
Dr. Hulseman, I'm fascinated. I'm learning way more than I thought I would.
This is all, to me, very basic stuff that we do at the Academy of Pediatric Special Needs. And in fact, I didn't mention that I'm a fellow with that organization. And when we are a group of clinicians really focused on teaching clinicians about these sorts of issues so that we can help kids on a much deeper level than just can we help them focus with medication. Because the problem with the you might have found in your child, their medications anymore because of side effects. But also, long-term outcomes with medications are not great. Actually, academically, they're not better than if you don't use medications. So I think we're really often treating the kid so that they can stay in the classroom and not necessarily so they can improve their academics. So other things should be done so that we can improve their academics, meaning finding what is the source of hyperactivity, what is the source of poor focus, and treating that instead. So that's what my practice is about.
So just in the example that you gave, where you said, was there a lot of stress in the mother's life during in utero? I mean, I'm thinking about not only my kid, but several kids who have had the repeated ear infections. So we've given them antibiotics, I mean, so many times that we've eventually led to tubes. So how are we to correct that?
Yeah. Well, if I can, so there's, I'm going to have two parts to that question, because the first one I'm going to answer is, what if there's a sibling coming along? If there's a sibling with that kind of a story, I'm thinking, okay, check your house for mold. Think about whether the kid needs to be treated from allergies. Make sure that there's no smokers or wood smoke around, anything that could be interfering with their ears. Stop dairy when they're young. Certainly, if they ever get a cold, stop dairy, because that's a common reason for congesting the tubes and then leading to the ear infection. Okay.
Really?
So if they're past that age, they've gotten bigger, the reason a person gets ear infections is because the eustachian tubes are small when children are young, and so they get clogged up, and then the fluid builds up and you get the ear infection. As they get older, the tubes open up more, and that doesn't happen as much, right?
Yeah.
So once they get past that age-wise, then it's, okay, well, what do we do to fix that? Well, healthy diet, low in carbs and sugar can be helpful, often way easier said than done in small children, right? Probiotics, and there's a whole bunch of different probiotics out there that can be helpful. And then if that's not correcting what's going on with their gut enough, which it often isn't enough, then you really probably need a practitioner to help you figure out, do you need a stool test, a urine test, or go by the clinical history and decide, is this a child with yeast overgrowth or bacterial overgrowth or something else which is in their poor focus? And also leading to their gut dysfunction, because if you have a chronic occult infection like that, some of my colleagues, by the way, would argue, gastroenterology colleagues would argue, it's not really an infection, but more an overgrowth. So, a little bit that's splitting hairs. But either way, it's not going to have a healthy environment for healthy gut development. So if the gut healthy, then the development will be healthy, then the absorption of nutrients will be fine, and then the brain can develop more typically. And there could be less hyperactivity and poor focus.
Can we be honest for a second? If the words school stress make your eye twitch, same, because traditional school plus ADHD plus already fried nervous systems, phew, that's chaos we did not sign up for. That's why I love Me Academy. It's an online learning platform that lets kids learn at their own pace. No rushing, fewer power struggles, and way fewer homework meltdowns. Yes, please. As a mom, I love that it offers structure without rigidity and learning without wrecking our relationship with our kids. They can rewind lessons, pause when their brain taps out, and actually understand the material. If your 2026 goal is less chaos and more peace, this one actually delivers. Check out meacademy.co to learn more and start your trial for just $1.99. Me Academy isn't about perfect school. It's about school that works for real life. Interesting. Every time I learn something about ADHD, I think I need to go back to college, and there's a bunch of courses in there that I missed. And
yeah. Well, I would love to see a more holistic view to kids with ADHD. As of when did this statistic first come out? Several years ago, 15, 20 years ago, 1 in 6 kids with ADHD. So I'm old enough that I did not see that kind of poor focus when I was in school. It just was not there. Now, there were kids who were more focused than kids, and there was some hyperactivity, but not to the degree that's there now. Something has clearly changed some things, not only one thing, many things have changed in our environment to make it very hard for our kids to stay focused and function the way they should.
Do you want to dive into what those changes are that has created the inattentive kids?
Sure. I mean, it's theoretical. There's no one thing and there's no proof. These are all theories, right? But what the sort of collective data looks at is many things. One is way too many environmental toxins. We just have gotten more and more chemicals dropped on the planet. And the majority of chemicals that are used in the US have not been studied for safety, and very few have been studied for safety in kids. It's more often the case that a chemical is produced, it's thought to be relatively safe, and then it's added to the milieu. There was a study from the Environmental Working Group, I think it was in 2005, where they looked at cord blood, newborn babies, and they were looking for 400 different chemicals, I think, and they found something like 250 different chemicals in babies' cord blood at that time. Now, there have been a lot more chemicals added to the planet since then. So it's a bunch of different chemicals. That's one thing. I do think one of the biggest chemical mistakes we've made in our country was to allow glyphosate or Roundup to be used the way it's been used now. So that corn and soy are genetically modified so that Roundup doesn't kill that plant. It kills all the plants around it, which may account for why we don't have as many bees and not have as many monarch butterflies as we used to. But it's also a very toxic chemical to bacteria. And studies in Europe it's banned. Studies in Europe show that it's associated with cancers like colon cancer. Again, it's not been proven, but I suspect the increase in colon cancers in the US is because of Roundup, glyphosate. So chemicals is a big reason. The other thing is intergenerational toxic exposure. So we know that grandmothers who had high lead levels as kids are more likely to have grandchildren with ADHD. Mm-hmm. And during the 20th century, it was first known that lead was toxic in the 30s, but it wasn't until the 60s that it was taken out of paint and gasoline. And many of us were exposed to a ton of lead during that time. Also, mercury. There's huge exposures to mercury because mercury it's still in the gray fillings that a person has in their teeth. Not the gray caps that you might have on your young child's teeth, but the gray fillings that adults and older kids might get. Very few dentists are using them anymore, but it's still considered safe, quote unquote, by the American Dental Association. But we know that mercury leaches out into a person's body and can be passed on to the kids in utero. Also, there's a lot of mercury in fish, say tuna and large fish. Really, children should not eat any of those large fishes, no tuna at all, because of how much mercury is in there. And certainly pregnant women should not as well. So environmental toxins, big time. Probably the big thing. I think the other thing is that as time has gone on and we've over-farmed our soils and not rotated crops well, then we've depleted the nutrients in the soil. So our food is not as nutritionally dense as it used to be. That's another piece. I think also the use of electronics has been a problem because people are tending to watch, and we're all guilty of it, right? I mean, I can't say that I'm innocent of that. That we spend time sitting in front of our electronics, and with small children, if they're doing that, then they're not crawling around, they're not running around, they're not being creative, they're not interacting, they're not doing these things to really help fulfill their brain development like we did 50, 60, 70 years ago. Water has become more polluted as well. I think the other thing that's more controversial, and some of my colleagues may roll their eyes at me, but I think we over-vaccinate our kids. I think we're doing too many vaccines in young children. There's all the vaccines, except for the viral vaccines, have aluminum in them. And if you give, forgetting the name of this scientist now, but there's a scientist at Harvard, I believe, who calculated how much aluminum is in the childhood vaccine schedule. And if you follow the current recommendation for a 2-month-old, they're getting something like 10 times the accepted safe amount of aluminum in their vaccines at 2 months. Wow. So, and most of those vaccines don't have to be given that early. Hepatitis B, for example, is not necessary in every child. In fact, it's only a very minority of kids who really need hepatitis B as newborns. We should get that out of the schedule altogether. And we should slow down the vaccinations early on and not do them too early. I'm a big believer in vaccines, but not in our current vaccine schedule. It's, I think, quite distressing. And maybe they're interrelated in that in a time when we weren't so toxic, maybe we would be able to tolerate the sort of vaccine schedule that we have now. I don't know. We don't know because it all came together at the same time. So there may be other factors, but those are the ones that all pop into my head right at the moment.
What about those of us who have already flubbed it up and we have already done the whole 10-year schedule on target? Did we really muck it up, or is there ways to save it?
There's ways to save it, and you have no idea if you did or not. I have many patients in my practice where they're quite clear they're vaccine and they lost developmental skills. My children did not, and they got the full complement when there was even mercury in the vaccines. So I think it's just a piece of the puzzle. And so I would say, don't stress about it. If you have another child, slow down the schedule, talk to a practitioner who is more aware of these issues, because unfortunately, most doctors now erroneously think the vaccines are 100% safe. I guess they're not even looking at the package inserts. Mm-hmm. They don't realize it has aluminum. They don't realize we could be giving toxic amounts of aluminum to our kids, or they wouldn't be doing it, honestly. I mean, doctors only want to do well by patients. But if it's already happened, then you say, well, okay, let's assume there are environmental toxins from those vaccines, and as part of treatment, let's try to eliminate those toxins. The best way to eliminate toxin, or the first thing to do to eliminate toxins, is to avoid additional toxins, right? So think carefully about a vaccine, whether you really want to do it or not, as one example. But also clean up the environment in your home. There are a couple of good books that I recommend for patients. One of them is called The Toxin Solution. I'm forgetting the name of the other one, but a couple of books that you can look at that will look at your home and your home products and whether they are relatively toxic or not. And even if it's not really toxic, if you're using a cleaner that has an odor to it, it's another chemical that your body needs to manage and your child's body needs to manage. So get it out of your house so that can help your child detox. And, try to get them to eat healthy, organic, very so that they're not getting something that's not in that category. And then maybe think about talking to a practitioner who can help you go deeper if that's not enough.
Yeah. So you brought it up in one of your lectures that your daughter was diagnosed with PANDAS, and that was very new at that time. And honestly, it's very new to me now in 2025. Do you mind to explain to our listeners what that is?
Yes, sure. Sure, happy to. Yeah, it was first described, I believe, in 1998 by Susan Sweeto at the National Institutes of Mental Health. And it was at that time associated with strep. And so PANDAS is pediatric autoimmune neurodevelopmental difficulty associated with strep. I think that's the term. But now it's been realized that actually any infectious agent can do that. And so the classic symptoms of PANDAS is the kid is doing fine, typical in whatever way, and then they have a turn, become more anxious, more obsessive, maybe more aggressive, less focused. They can have tics, they can have handwriting difficulties, more poorly academically, and it usually occurs either because they have a strep infection or they're exposed to somebody with a strep infection. And again, we've now recognized that can occur with influenza, it can occur with COVID. COVID's particularly bad with it. It can occur with skin infections, it can occur with yeast overgrowth, it can occur with mold exposure. And it's really an inflammatory condition of the brain that's triggered by that agent, by that infectious agent. So we can treat it with antibiotics, and sometimes that will help. Sometimes it doesn't help because some of the infections may be more chronic, and it may not be really about the presence of the infection, but more the presence of the bacteria and the particles of the bacteria that's triggering the immune system. Mm. And in my daughter's case, I think you probably remember that what was interesting to me is it wasn't until in retrospect that I realized that's what was going on with her. During her kindergarten year, she had several episodes of strep, and all those symptoms developed in her. And then away a couple years later, in her case, she had a heavy load of lead and mercury, in part from her vaccines and also in part from exposure, not the lead, but the mercury, part from exposure from me in my childhood. And treating that, getting those toxins out of her body, the PANDAS went away. So when I'm treating kids with PANDAS, yes, I may short-term use antibiotics and I may use nutrients to help decrease inflammation, but I'm also going to say, well, what are those environmental toxins that we need to also get out of that person's body so that their immune system grows up, so the inflammation goes away, and so their brain functions normally.
Outside of antibiotics, how else would you treat a situation like that to get the toxins out of the body?
Anti-inflammatories. Well, to get the toxins, so it's two different things. Short term, I use things like occasionally I'll use oral steroids and things like ibuprofen, curcumin, and other anti-inflammatory, broccoli seed extract, and some other anti-inflammatory things can help at the moment, certain fish oils. But then I'll look to see what's the toxin. So if we're thinking by history that there could be mold, then we can do well, first of all, test the house, because if the house has mold, they need to clean up the house, and then we go for further mold treatments, which involve a whole bunch of different things I could talk about if you want. But or I test the person, which is to do a urine test looking for mold toxins in their system. If we're talking about toxic metals, then you can do a urine test before and after giving them a medication that pulls out the toxic metals. So you're comparing the urine test before and after with the idea that they have retained lead, mercury, aluminum in their body, and that medicine pulls it out into the urine. You can see it coming out. And then you can't even be sure that it's relevant until you treat and see how the person gets better. But usually, if it's a decent high test, it's going to make a difference to get them healthier. Those getting rid of toxins, though, is not like snap. Yeah. It can take months to years to eliminate toxins. It's from a person's body. It's not a quick fix. So those antibiotic, anti-inflammatory nutrients can then help them function while you're getting those toxins out of their system.
Gotcha.
And I always try to get them off antibiotics as soon as I can. Of course, I'm an MD. I'm a traditionally trained doc, but I've learned over the years from my naturopathic colleagues about herbal treatments, and I'll use herbal treatments when they work and when they're appropriate. They're usually safer and less hard on the GI tract than traditional antibiotics. But it really depends on the kid and the situation, and sometimes finances, because often will cover an antibiotic, but it won't cover an herbal product. So that sometimes plays a role, but I think most parents try as hard as they can to get them off the antibiotics because of how hard it can be on the kid too. But it's always risk and benefit. How is the child functioning? What's the risk to themselves and to develop versus the risk that the antibiotic might be causing?
So that story is not true of me. My son has shown very classic ADHD symptoms for a very long time, even before he could technically be diagnosed with it. But for our listeners who just had that aha moment of, oh my gosh, my kiddo had this abrupt change in behaviors. At this point, they need to get to someone who is well informed to know what to look for and to try to get maybe some immediate care going and then a long-term plan.
Right. I would say, yes, that's correct. And where I would direct them would be to the MedMaps website. It's medmaps.org. Or they could also look at the PANDAS network, although they'll find more practitioners, I think, on MedMaps.
And those will be the well-informed, outside-of-the-box thinkers who can take us where we need to go.
They should be, yes.
I hope my son's pediatrician never listens to my podcast because he is absolutely amazing. I live in very rural North Carolina, so he is the best of the best. But he is very typical medical straight line. Any supplements that I have thought of or recommended or questioned, he's like, well, I mean, that might work. He's like, but we also have these other things. So, yeah.
But he's at least not discounting it. That's a plus, because I think some of my colleagues will say, oh, there's nothing to it. There's no data. There's no experience with that. That's actually not true. There's not enough data ever for what I'm doing, but there is lots of clinical experience. But that's still a good doctor, I think, because you could say, well, I've read this thing, or I talked to this other practitioner, or I learned this something else, and I want to try this particular nutrient, just letting you know. And there have been prescription nutrients for ADHD. Years ago, there was I'm getting the name of it, but it was basically a phenol and phosphatidylserine combination that was prescribed for focus. But it was priced so high that they couldn't sell it, and they couldn't get insurance companies to buy into it, so it's not available in the US anymore. But there are combinations like that from good quality supplement companies. By the way, that's the other thing that's really important, I think, for your listeners to know, is that if they want to try supplements, they need to be sure they're high quality, because there's a lot of really bad things out there. And I think there's very little that's going to hurt somebody. I could be wrong on that. But there's certainly a lot of things where you're simply going to be wasting your money because they're just not good enough products. And even within that, I find that there are certain companies that will make certain products better than others, even though they're good quality companies. Yeah. So that's the other place where a practitioner can really help you a lot in terms of deciding, is this a good product or not to try for my child? Because why waste your money and why waste your child's time if it's not something that could be beneficial?
Another thing that I believe we do, not to stereotype all of us, but we join the forums and the online communities and we see what's working for everyone else. And then we go out and buy 20 at a time and we start it. And then something in that 20 works, but we don't know what it is because we've started 19 other things with it. So we should start maybe one at a time and see what works.
Right.
That way you may not spend your money on the other 19.
One at a time. One at a time. Exactly right. And a difficult thing. And so I always have used at least one thing at a time, a week apart. There's some exceptions to that, but generally at least a week apart. Some things that may take longer before you notice difference though. So that's another thing to just be thinking about as a parent. Am I likely to see improvement in that week, or do I need to give it more time or not? And then the other thing is periodically stopping things, particularly if it's a deficiency you're treating. It could be that your child's tank is full and you don't need to continue that process. So yes, that's a very good point. The other issue with online forums, I think, too, is that people more often than not will tell you their success stories and not necessarily when things don't work for them. And every child is individual. So, I get this all the time where somebody just like love the fact that, whatever, methyl B12 helped kid tremendously. Actually, that tends to help a lot of people. So like get a different example. But this particular product was just amazing for my child. Everybody tries it, and maybe a third of them get benefit and 2/3 don't, because that's not what that child needed. Now, sometimes you just have to try it. But the ideal thing is that you either have some type of data or work with a practitioner who can help you figure out for your child at this time, is that the thing to do? And usually when I'm working with patients, and I think most of my colleagues are like this too, is that we'll start with the things that most commonly will help everybody or will most commonly help a few symptoms. So usually it's not just poor focus or hyperactivity, it may be impulsivity or other things, poor sleep, other things. And so I'll try to target like broadly first and then go more specific so that you're not, going down into the weeds with that 15th or 20th supplement that your child really didn't need. Some other kid might, but you just didn't.
Full disclosure, I have tried for years to get my kid to take a multivitamin. I've tried everything. And then finally, one of the name brand, I think it's Little Critters, they finally started making the gummy bears that actually had a teeny tiny bit more sugar in it. But for the first time in 10 years, we're actually taking vitamins. So I'm taking my win. And I hope that it's doing a little good. But yeah.
It's probably doing a little good, and it might be a start. So that also raises the issue of when a kid is around 5 to 6, you can typically teach them how to swallow pills if they're willing to work with you. And the way that I like to teach kid how to swallow pills is to get some empty capsules. So if you have some supplements that you're opening up in capsules, you can save those, or you can get them from compounding pharmacies. And then what you do is take that big empty capsule, open it up, of course, cut it down, put it back together so it's a little BB-sized thing. Have the kid put it in their mouth with a sip of water and look down. That's all they need to do. And then it will float to the back of their throat where it's in the right place to swallow. And then they can practice with a bigger and bigger empty capsule. And if you work with your kid for a couple days and they can't get it, it's too soon. Just put it on the back burner, try again later on. But usually in 2 days, they will get it. And all you need to do is have a kid who is willing to put it in their mouth and look down and willing to swallow the pill. And of course, lots of rewards and good job and whatever. And then it's easier to provide supplementation. But there are more and more ways, like better supplements, better flavors, different ways of working with kids, and also just starting slowly, especially if your kid has a taste aversion. There's a multivitamin like that is mixed, it's a powder that's mixed with water, and it has a berry or lemon flavor. But some kids, that flavor is way too strong. And so what I'll have parents do is sprinkle it teeny tiny bit in water, all the kid will drink, and then get used to that teeny tiny bit, and then give them a teeny tiny bit more. And it might take you a few weeks, but you can very gradually get them to do that generally, especially if lots of rewards, good job, and it depends on the kid too. If your kid is 6, for example, 5 or 6, they often really like imagination and superheroes and being smarter, and so smarter and sharper and stronger. And so you can kind of use those sorts of ideas. If it's an 8 or 9-year-old, it may be more, okay, they recognize they're having trouble in school and they're not focusing in school and they're starting to get frustrated. It's starting to bother their self-esteem. Well, then you can talk with them about, well, maybe it'll help you focus a little bit better. Why don't we try it? Work together to get you to be able to take this. Okay. And I never want parents to hide a supplement, and I never want parents to force their kid to take it, because it's going to backfire. If you hide it, they're going to figure it out and stop eating that food. If you force it, they're going to get bigger, and you're not going to. So it's not going to work to do that. Having said that, there are a lot. I haven't looked at the Little Critters, but there's I guess I will go ahead and name some brand names. But the Smarty Pants and the Ollie Always, I believe that's what they're called. The Mary Ruth's vitamin, those are all basic good multivitamins. When I have a kiddo who's poor energy, when I'm worried about environmental toxins, and when I'm worried about their energy overall, then I like the powder multivitamin is Spectrum Needs from Neuro Needs. But Spectrum Awakening from Aspire, those are good quality ones that have the right type of B vitamins. That's really what you want to look for, the right type of methylated Bs that can help with focus and overall detoxification and development. But it can be a challenge for sure to get kids to take supplements.
Having recently, and I mean very recently, I think it was Tuesday, we found out that my kiddo cannot take stimulant meds anymore. I think my next step may be the Spectrum Needs. I think that, Dr. Bowles' story in general with his son transitioning off of stimulant meds and having such success is already such a powerful story. But our stories are more similar in the fact that when my kiddo was on stimulant meds, he couldn't eat. So there was only like the evenings and 2 days a week that he was able to actually take in food. So I think that will probably be our next course of action, and fingers crossed that we get some relief there, because he's already seen in 3 days. He said, "Mom, it's really hard to sit still without the focus meds." And I said, "Well, I'm glad that you have that awareness now that you can say, hey, this is what's happening." But yeah, we're in for a wild few weeks, Dr. Hulseman.
Yeah. Sounds like you might need a MAPS practitioner to help here.
Yes.
But it is good. How old is your son?
10.
He's 10.
Yeah.
Nah, he could probably learn to swallow a pill if he's a 10, if he's a 10-year with that kind of speech, and then you could have a lot more options in terms of multivitamins and stuff. But the Spectrum Needs is good. And I think also, as I said, as a 10-year-old, with that kind of self-awareness, you can work with him to figure out what's the vitamin that he likes to take, and what does he want to do to try better. Yeah. And it's odd, but I've had a number of kids where they were hyperactive and they started a multivitamin with lots of mitochondrial support, lots of B vitamins, things you would think that would make them more hyper, and they were less hyper. Now, if they're more hyper, there's something wrong with their gut. That's what needs to be taken care of. They've got, again, yeast or bacterial overgrowth, something going on in their gut, because they shouldn't be more hyper with the multivitamin, generally.
Dr. Hulseman, many years ago, we created a masterful haggler so I can get him to do anything with bribery.
Okay.
if there's anything in it for him, he will cooperate and participate. And so
well, that's true for most people. Right?
Yeah.
We always want to know what's in it for us, and in part, that's kind of what I was talking about, right? What's in it for them is that he can pay attention better in school and he doesn't get into trouble, right? Because kids don't like to get into trouble. They don't want to be getting into trouble. They want to be focused. They want to be engaged.
Yeah. I may also have to throw in like $10 to try a supplement for a few weeks type thing also.
Sure.
But I'm okay with that.
You have to do what works.
That works.
Exactly. And also, if it starts to really work, he'll be more trusting of you and more willing to do it without that kind of reward, right? It'll be the reward itself. Yeah.
Dr. Hulseman, I could do this all day. I would selfishly soak up all of your time, but I want to be respectful. I'm so glad to have you here. Do you mind to tell the listeners about your upcoming event and how they can connect with you further?
Yes. So I did give a talk in November. I actually, for years now, I have given a talk for parents, primarily parents with kids with autism, but applies to ADHD, where I go through what are the medical problems going on with kids who are having developmental problems, and what are the solutions. And there's a recorded talk from last November on my website, which is allaboardim.com under parent resources. I will be doing a live talk coming up in the next few weeks. I haven't yet decided when that will be, but if it's interested in the live talk, they could send us information through the contact form, and we'll put their name on the list. And that live talk will be in person in our office, but also online. That's the plan anyway, so that people can hear upcoming. And things aren't a lot different than a year ago, but there are always some new changes, some new data that's coming in, some new information that's coming in. There's a lot of buzz right now about leucovorin. I don't know if you're aware of that at all, Danielle, but leucovorin type of B vitamin can help with speech and awareness in kids with autism. It's possibly one of the first nutrients. It actually is a prescription medication, but it's a nutrient. But it's one of the prescriptions that might be approved by FDA targeted towards autism symptoms. But there are caveats to that. It could cause ADHD, it could cause poor focus and hyperactivity and stimming if it's given at the wrong time. So I may discuss that a bit at that upcoming talk.
Interesting. Yeah, that sounds amazing.
Yeah. And then if people want to know more about practice, that would be the place to go as well.
And I will, of course, link all of that in the show notes for listeners to just easily click to you.
Okay. That sounds great.
Dr. Hulseman, I can imagine that some of our listeners are slightly overwhelmed by all of the places I have taken you in our conversation today. Sure. Do you have any parting advice for the already frazzled parents? Maybe a simple step they can take.
I think the simplest step is to look at your child's diet. Look at your child's diet, see what you can do to remove things that could be causing harm. I think that would be the first thing that I would do. The second thing I would do would be to look at your environment and all aspects of your environment. And again, the toxin solution is a good place to start. Though often people can get actually a lot of improvement just thinking about those two things. And I could go on, but I think the longer I'm on this planet, the more I think we need to be not necessarily getting rid of everything modern, but going back to some of the basics, like making sure your kid's getting enough sleep. Don't run them ragged, make sure they have some time just to be a kid. Just enjoy hanging around them, just enjoy hugging them and going for a hike and a walk and get that physical exercise in every day. Yeah. Those basic things go a long, 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 long ways. And I have had some families where they just did that. They saw me once or twice and they didn't really need to see me again. Their kid turned around. Now that's not what it means, but those very basic things can be huge. That's more than one thing. Sorry.
No, I think that's amazing. Clean up our diet and go for a hike. I mean,
exactly.
Look at our environment. Exactly. That's back to the basics. I love that.
Back to the basics. And, back to the basics, I also want to reinforce there is data behind those basics. I don't know if anybody has ever heard of, on your listeners have heard of forest bathing. It's a concept from the Japanese. Mm-hmm. The idea is to go out and be in a forest. Well, researchers have actually looked to see what does that do to our immune system. And it actually promotes natural killer cells, which are cells that help to fight fungal infections. Mm-hmm. So you go out into the woods and you go for a hike for 30 minutes, you've improved your immune system by 45 to 50%. So it's not nothing. It's actually quite big to do those sorts of things.
Yeah. Dr. Hulseman, this has been amazing. Thank you so much for your time today.
Thank you. It's been fun.
If you're sitting there right now thinking, wait, you mean there might be more layers to this than just behavior charts and begging for school accommodations? Girl, take a breath. Because what Dr. Hulseman reminded us today is this. Our kids are not broken. They are not lazy. They are not too much. Sometimes their brain and bodies just need deeper support than the system was built to give. Dr. Hulseman has spent more than 3 decades in medicine, not chasing trends, not throwing spaghetti at the wall, but asking better questions, looking under the hood, connecting the dots that often get ignored. And whether you ultimately choose an integrative approach, or traditional routes, or a blend of both, the power is in knowing you have options. That's what New Year, Less Chaos is really about. Not perfection, not biohacking your kid into some Pinterest version of calm, but understanding what might be contributing to the chaos and taking one grounded, informed step at a time. If today's conversation cracked something open for you, I highly recommend checking out Dr. Hulseman's work in the show notes. While you're there, do all of the things for the algorithm gods, like, subscribe, leave us a review, 5 stars obviously, but so much more important. I need you to send this to a friend who's drowning in school emails and second guessing everything like we used to be a few years ago. Screenshot it, share it, let's normalize digging deeper. And, as always, if you're raising a neurodivergent kiddo in a world that still doesn't quite get it, you are not alone in any of this. That's it for this week on Chaos and Caffeine. I'm Danielle, and I'll see you next week. More chaos, maybe, More caffeine, abso-freaking-lutely, but also a little more clarity. Parenting neurodivergent kiddos feels like trying to build IKEA furniture blindfolded sometimes. You know there's a manual, but it's all in Swedish. That's exactly why I want to spotlight Insight Family Market. They aren't another generic store. They're a curated marketplace built by someone who's literally been in the trenches as an educator and parent, selecting tools that actually make daily life more manageable for real families. From sensory-friendly clothing and adaptive tools to educational supports and wellness essentials, everything is chosen with a family-first mindset. No clinical jargon, no guessing what might help. What I love is that it's not about selling you a quick hack. It's about offering thoughtful, quality products that help create more calm, more confidence, and more actual functioning in chaos. Whether that's at mealtime, bedtime, homework, or quiet moments between the noise. If you are exhausted from chasing solutions and just want a place where the gear feels like it was picked by someone who gets it, Insight Family Market might be that stop on your journey.